Hello everybody, and welcome to Species Specifics. Today we're going to be discussing non-human primates. If you are new to this series, the goal of these lectures is to cover unique diseases of different veterinary species that are specifically mentioned in the ICVA NAVLE study guide. I've also included some diseases that are not specifically mentioned, but may still come up. The focus of these lectures is on disease recognition through images, clinical signs, and diagnostic tests. I've also highlighted key, easily recognizable characteristics in bold. We only have a few diseases to cover, so I've put them in no particular order. The first is gastroenteritis. Gastroenteritis is primarily caused by Shigella and Campylobacter in this species. It can lead to diarrhea, dehydration, and rectal prolapse. Treatment is similar to other species, with fluid therapy and antibiotics as clinically necessary. Careful use of antibiotics is very important in non-human primates, as the pathogens that can cause gastroenteritis in these species are highly susceptible to antibiotic resistance. Herpes B is a zoonotic disease that is transmitted by biting, scratching, or mucous membrane exposure. It can cause fatal encephalitis in people. All macaques are potential carriers of this disease and should be handled very carefully. In the macaques themselves, disease is typically subclinical, but it may cause oral vesicles. There are three notable hemorrhagic viral zoonoses that affect non-human primates. These are Marburg virus, Ebola virus, and yellow fever. These diseases can cause sudden death in wild-caught animals. Treatment is not usually indicated in these animals due to the high mortality rate and the risk of zoonotic transfer. Mpox was previously called monkeypox, and it is a reportable zoonotic disease. It can cause a rash with pustules in non-human primates. Treatment involves supportive care. Animals typically have a good prognosis, and they will develop immunity against future infections after they recover from their initial infection. Rubeola is the cause of measles in humans. It can also affect our non-human primates. Marmosets are extremely susceptible to this disease, and therefore human children should not interact with this species of primate. In the primates, it can cause rash on the face and chest, similar to what we see in people. Treatment involves supportive care, and it can be prevented through vaccination. Simian immunodeficiency virus is closely related to human immunodeficiency viruses and can cause AIDS in macaques. However, most infections are subclinical. When clinical signs do develop, you can see lymphadenopathy, weight loss, and diarrhea. Treatment primarily focuses on supportive care. Toxoplasmosis can be highly fatal to squirrel monkeys and ring-tailed lemurs. It typically affects the liver and lungs in these species. Clinical signs include lethargy, anorexia, diarrhea, and dyspnea. Most cases are rapidly progressive and ultimately result in death. Tuberculosis is most common in Old World primates like macaques. Many animals are asymptomatic, but they can show signs such as coughing, weight loss, and enlarged lymph nodes. Euthanasia of affected or carrier animals is recommended due to the public health risk. Preventative measures include tuberculin testing for all non-human primates that are entering a colony, and semi-annual testing to help identify any new carriers. Pulmonary acariasis is caused by pneumonisis mites. These mites primarily affect rhesus monkeys and baboons, and they live within the terminal bronchioles of the lungs. Clinical signs are primarily coughing and sneezing. The main treatment is ivermectin. Most non-human primate species cannot produce their own vitamin C and thus require dietary supplementation. Clinical signs include bruising, hemorrhage, and gingivitis. Treatment involves oral supplementation, while including commercial vitamin C products, leafy vegetables, or citrus fruit in the diet are good preventative measures for preventing scurvy. Finally, we have endometriosis. This is ectopic endometrial tissue that is within the abdominal cavity, and it primarily develops in older menstruating primates. Clinical signs include abdominal discomfort, menstrual irregularities, and infertility. Treatment involves ovariectomy and potentially a hysterectomy as well. Thank you for watching Species Specifics. If you enjoyed this video, remember to like, subscribe, and share with your classmates. If you're feeling generous, there's also a link in the description where you can buy me a coffee to help fuel future videos. Thanks again for watching, and we will see you in the next video.